Reactive arthritis. It is derived from the words reactive, which means reaction to an infection in the body, arth, that means joint, and itis, that means inflammation. Reactive arthritis is also known as Reiter's syndrome, reactive spondyloarthritis, and REA. It was previously called Reiter's syndrome, named after German physician Hans Reiter, who first described this syndrome. But the name Reiter syndrome was dismissed because it is believed that Hans Reiter was a member of the Nazis, under whose leadership the war prisoners were subjected to many inhumane experiments. It is believed that coming into contact with bacteria and developing an infection, it can trigger the disease. So after contact with bacteria, it develops infection in other parts of the body that triggers to cause reactive arthritis. It is a seronegative disease, that means rheumatoid RA factor will be absent. HLA-B27 is linked in this sort of arthritis. It is an autoimmune disease. It has been postulated that Italian-born explorer Christopher Columbus had reactive arthritis and died from a heart attack caused by this condition. Etiology. The main cause is idiopathic or unknown, but it is probably an autoimmune disease as a test for the HLA-B27 gene is positive in about 90% of cases. And it is more common in white than in black people. There is a mnemonic for seronegative arthropathy or disease that includes HLA-B27 gene. The mnemonic is PAIR, P-A-I-R, where P stands for psoriatic arthritis, A for ankylosing spondylitis, I for inflammatory bowel disease arthropathy, and R stands for reactive arthritis for Reiter syndrome. Types. Reactive arthritis is divided into two parts on the basis of the type of infection after which the disease originated. First one is post-vendal or sexually acquired reactive arthritis or SARA, and the another one is post-gastrointestinal type or enteropathic reactive arthritis. When the infection occurs after sexual act, the causative organisms are Chlamydia trachomatis and Ureaplasma urinalicum. And when the infection occurs after gastrointestinal tract infection, the causative organisms are Salmonella, Shigella, Yersinia, and Campylobacter. Clinical features. It is most common after puberty at the age of 20 to 40 years. Males are commonly affected. The male to female ratio is 15:1 in case with STD, while 1:1 after enteric infection or type 2. Reiter's triad. It includes 3 symptoms. First one is conjunctivitis, that is inflammation of conjunctiva, the outermost layer of the white part of eye and the inner surface of the eyelid. Urethritis means inflammation of the urethra, and arthritis, inflammation of joints. One clinical mnemonic in reactive arthritis is can't see, can't pee, can't climb a tree, where can't see stands for conjunctivitis, can't pee for urethritis, and can't climb a tree is for arthritis. In In case of post-venereal type of sexually acquired reactive arthritis, the symptoms of arthritis develop after 1 to 4 weeks after a sexual act. And after 1 to 3 weeks of arthritis, patient develops conjunctivitis with red eyes and watering from the eyes. And after a week of conjunctivitis, patient develops arthritis. Urethritis. The urogenital problems along with urethritis may arise as prostatitis, that is inflammation of prostate in male, while cervitis, that is inflammation of cervix, salpingitis, inflammation of fallopian tubes, and vulvovaginitis, inflammation of vulva and vagina in women. It is a non-specific urethritis or non-gonococcal urethritis, that is an infection of the urethra that is not caused by gonorrheal infection. Symptoms of urethritis develop after 1 to 4 weeks after the sexual act. The urethral infection is caused by Chlamydia trachomatis and sometimes by Ureaplasma urelyticum. The classical presentation of the syndrome starts with urinary symptoms with increase in frequency of micturition and dysuria, that means painful or difficult urination. Conjunctivitis. After 1 to 3 weeks of urethritis, patient develops conjunctivitis. Conjunctivitis means inflammation of conjunctiva, the outermost layer of the white part of eye, and the inner surface of the eyelid or uveitis, that means inflammation of the uvea, the middle layer of the eyeball. It can include eye pain with watering from eyes, redness of the eyes, irritation, and blurred vision. Arthritis. After a week after conjunctivitis, patient develops arthritis with inflammatory arthritis of large joints. Asymmetric oligoarthritis means less than 5 joints are affected. Lower limbs and enthesis are predominantly affected. Enthesis is the junction between the tendon or ligament and bone. The cardinal sign of inflammation like pain, swelling, redness, and heat sensation in the affected areas are present. Commonly affected joints are knees, ankle, small joints of feet, and sacroiliac joint. Arthritis may be of two types, addictive and migratory. In addictive, more joints become inflamed in addition to the primarily affected one, while in migratory, new joints become inflamed after the initially inflamed site has already improved. Other features include keratoderma blennorrhagica, It is post-venereal cases. These are small hard nodules which begins as discrete, waxy, with discriminating margins. Yellow-brown vesicopapules means a papule that changes into a blister, occasionally coalescing to form large crusty plaques on the palms and soles of the feet. Ulcers in mouth that often comes and go. In some cases, these ulcers are painless and go unnoticed. In the oral cavity, the patient may suffer from recurrent access stomatitis. Geographic tongue or map-like pattern on tongue to appear as smooth reddish patch surrounded by white borders. The red areas are due to absence of papilla. And migratory stomatitis. Succinate balanitis or balanitis succinata is a skin condition of a subpengenous ring-shaped dermatitis of the glans penis, which starts as vesicles on the coronal margin of the prepuce and glans penis that later is rupturing to form superficial erosions with minimal surrounding erythema or redness. Some coalescing to give a circular pattern as succinate balanitis. Pain in the sole of the foot due to plantar fasciitis means the inflammation of plantar fascia. Calcaneal spur or heel spur, that is a bony outgrowth that forms on the heel bone or calcaneal bone. Achilles tendonitis, inflammation of Achilles tendon. Nail dystrophy or deformity with sublingual hyperkeratosis, that means accumulation of keratin beneath the nail plate. Peripheral neuropathy, in which the peripheral nerves are affected and having symptoms like ulcer or slow healing wound, shooting or burning pain, sensitivity to touch, lack of sensation, increased falls, trouble sleeping, difficult walking, and tingly or numb feeling. Pleurisy or pleuritis, that is inflammation of pleura, the membranes that surround the lungs. Other symptoms are muscular pain, fever, malaise with weight loss. In cardiac symptom, there is aortic incompetence or aortic insufficiency. It is a leaking of the aortic valve of the heart that causes blood to flow in the reverse direction during ventricular diastole from the aorta into the left ventricle. Atrioventricular and intraventricular conduction defect, in which the conduction defect there is defect or a delay, or it may be completely blocked. Meningoencephalitis, inflammation of the meninges, the membranes that surround the brain and spinal cord, is called meningitis, while inflammation of the brain itself is called encephalitis. A neurological condition resembling both meningitis and encephalitis, that is inflammation of the meninges as well as the brain tissue, is called meningoencephalitis. Many signs disappear, but arthritis remains and recurrences are very common. Investigations. Blood examination. ESR and CRP are raised. HLA-B27 antigen is positive in 80 to 90% cases. ANA or antinuclear antibodies will be negative. RF factor or rheumatoid factor is negative. X-ray. Periarticular osteoporosis means osteoporosis occurs around the inflamed joint. Fluffy calcaneal spurs, that is a bony outgrowth that forms on the heel bone or calcaneus bone. Proliferative erosions, notably at the enthesis, a junction between tendon or ligament and bone. The urethra, cervix, and the throat may be swabbed in an attempt to culture the causative organisms. Urethral smear shows no bacteria because it is non-specific urethritis. Stool culture for post-salmonella arthritis. In salmonella, after post-salmonella infection, stool culture can be done. This is a mnemonic for reactive arthritis as a reactive, where R stands for RF negative, rheumatoid factor negative, red eyes due to conjunctivitis. E stands for eye pain, A for asymmetric arthritis, autoimmune, and antigen HLA-B27. C stands for conjunctivitis, cervicitis, succinate balanitis, calcaneal spurs. T is for tendinitis of Achilles or Achilles inflammation of Achilles tendon, geographic tongue. I stands for inflammation, infection that acts as a trigger, increased frequency of urination. V stands for venereal and vulvovaginitis, and E is for enthesitis. Thank you for your time.